We couldn't get away with May the 4th, be with you, with our little Star Wars music to start off this session of the, Brian, if you could start the slide deck. But welcome to the New Hampshire COVID Vaccine Alliance meeting on May the 4th. Be with you. Again, our mission here today is to help convene stakeholders across New Hampshire to promote vaccine confidence, support accurate and consistent messaging, and foster coordination of the vaccines allocation. To do that, we promote buy-in for COVID vaccines to increase immunization rates, act as a force multiplier, counter misinformation, and foster use of New Hampshire's immunization information system. We thank our Vaccine Alliance sponsors, Harvard Pilgrim, Anthem, Dairy Medical Care, Convenient MD, Wellson's Health Plans, and NH Healthy Families Health Plans. We've had a number of requests last couple of weeks for these discussions. If you go on the Medical Society's webpage under news blogs, you'll see each of these. In particular, we've had a number of requests for our discussion on legal issues and incentivizing for COVID vaccinations. And again, two others by Dr. Ballard about the transition from public to private vaccine allocation process, and we'll touch upon that a little bit more today, as well as implementing the IIS with Drs. Bailey, Alok Patra, and T.W. Hall. Next slide, please. All right, again, for any organizations who are interested in signing on to a joint statement for objective goals on continued COVID mask wearing, you can sign up by emailing me. The two principal goals are to reach community-wide immunity of at least 70%. And secondly, that COVID continues at minimal community transmission levels that are defined by two factors: less than 50 new infections per 100,000 population over the prior 14 days, and the 7-day PCR test positivity levels below 5%. Next slide, please. We also recommend in the statement to continue measures to help make science-based decisions on masking and other policies related to the pandemic, particularly as the state policies begin to cycle up at the end of this week and are replaced by essentially generic guidance from the state. And we'll provide links to that if you haven't seen that in our summary. Currently, we have over 30 organizations who have joined. Takeaways from this past week, of course, there is new parental consent incorporated into VINI for those under 18 for the COVID vaccinations. And this will also include consent for 12 to 15-year-olds, pending the FDA emergency use authorization approval, which could happen as soon as this week. As we discussed with Dr. Daly, the 7-day reporting requirements have been temporarily waived, but essentially requiring only reporting for state-supplied vaccines. But it is a dose-to-dose documentation. So you need to have a certain amount of doses recorded before you can reorder that amount of vaccine. And the HL7 messaging code was released the past week for those who signed provider agreements and indicated capabilities of upgrading to HL7 integrations. Next slide. So with that kind of information, I think that there's going to be some interesting discussions this week with Drs. Chan and Talbot and Daly at the Health Providers Weekly Forum that occurs on Thursdays from 12 to noon. And you'll see the link and other the passwords and whatnot My guess is that they're going to be talking a little bit more about the Pfizer EUA that's coming forward and any information that they have on that, and what that means. Also, if you've seen the governor's statements, I think it is his intent to help utilize New Hampshire school systems to help allocation for this new cohort from 12 to 15. And as many of you know, schools are currently working on the 16 to 18-year-olds in high school with specialized clinics. So I think this would be added to that. We'll try to make as much as they can with the remaining month and a half of school left to use that. My guess is that they'll be, like they were with teachers, they'll be working with regional public health networks at specific SAUs to move that forward. We will likely develop with the school nurses another outreach forum to PTAs to help educate parents about the Pfizer vaccine that should be available in the near future. Probably more discussion happening tomorrow, Wednesday, from 3:30 to 4:30 on that particular subject. Next slide, please. Okay, again, kind of reiterating the preparing for the vaccine allocation transition from a public to a private allocation system. Make sure your staff are trained on New Hampshire IIS. Make sure that you have operational protocols in place for how you're going to do those vaccines as part of your practice. And also make sure that you have information. We have two sources of information that you can use. One is the brandable COVID vaccine FAQs that are available on our website, plus all the information that is available on Sleeve Up New Hampshire. And the email address is there below. We'll publish that in the chat area. Next slide, please. So this next week, with this transition period happening, there are federal funds that have been given to the state, considerable a number of federal funds that they're looking to help practices, hospitals, federally qualified health centers, and independent primary care practices transition to be able to give COVID. So we were requested by the Division of Public Health Services to look at some of these factors, and we were able to survey within a few days' time 23 primary care and pediatric practices to assess their needs and costs in this move. And we focused on a couple of issues here, as you can see, what the costs related to manual entry under the IIS, any enhancements that would be needed to allow them to interface with HL7, workflow changes, storage, particularly ultra-cold refrigeration for the mRNA vaccines. And then also they asked us about mobile outreach to achieve health equity and reach populations who may not come into the healthcare setting. So some of the findings that we've had from this that we presented last Friday to the division include, number one, all clinics that we surveyed anticipated offering only closed pot to their patients. And so the idea of additional outreach or public was not something that they anticipated doing at this particular time. Next. The second thing is all clinics said that they needed assistance for increased staffing for the double data entry required for IIS. And for some of the larger primary care practices, the cost ran up to $25,000 per month at each clinical site without the HL7 interface. So as it turns out, the initial, let's say 3 to maybe even 5 months from transitioning from manual to the HL7 is probably where most of the practices said, or all the practices said, that they thought that's where most of their costs were going to be. Next. Third, ultra-low freezers were needed in about 2/3 of the clinical sites. Now, this is based on the assumption that the mRNA vaccines, both for COVID and in the future, would be delivered on the same schedule as other state vaccines, more like on a monthly basis rather than a just-in-time basis. So depending upon how much effort the state decides it wants to put into distributing the COVID vaccines, those assumptions could change, but based on just the need to store the mRNA vaccines at a longer duration period, most of them, about 2/3 of the sites said they didn't have the capacity right now. So continuing, for EHR system upgrades for HL7 compliance, about half the clinical sites said they needed to make some investments in those. Those investments range from $30,000 up to about $150,000 they thought they would have to do in software changes to be HL7 compliant. So another sizable cost there. One thing that most of the clinics thought that was that the waste management, any upgrades there would be a marginal cost for them at this particular, if they're already providing vaccines. Next. And then when asked about communications and marketing, the preference was something that was brandable in either print, digital, social media, and other information sources that they could go to rather than necessarily recreating their own materials. So the things that we described about with Sleeve Up New Hampshire and what we provided in are good examples of that, but likely we could bring more information that's provided at the federal and other sources to assist you in those efforts. And finally, supplies were thought to be covered by public and private insurance reimbursement for COVID vaccines. And this is what the department concurred that that's also how they would view this. The one thing that wasn't covered under these items was the idea of outreach using a mobile van or RV or Winnebago to reach out to specific populations. If you have those capabilities, please email me or call me and discuss those. I think the division is interested in utilizing those type of services over the summer. It's how we do it, and how we do it in a quartered way, I think, is what everyone is trying to figure out. Other items, the average cost of the ultra-low temperature freezers from estimates that we received averaged about $17,000 for a 7.5 square foot cubic upright that could hold up to 384 2-inch boxes of the vaccine. The other thing that was noted there, in most cases, that the ultra low temperature freezers required a different or electrical upgrade, and that the costs per month were on average about $30 a month from the literature. Just a little bit more background information there. Other items as far as broad communications, I think that item is still under discussion with the division on how they might handle that or coordinate those getting that information out further. So with that, that's a quick summary and what we have to present today. We're hoping to have some special guests next week to talk about the transition. And still the assumptions are that one, this transition period will begin during the month of May and go into the month of June for going forward. And thank you very much for the comments on the music at the beginning. And we're happy to take on any other questions that you might have at this time. But that's kind of what we know. Probably the big information, again, will be the emergency use authorization for the Pfizer vaccine for 12 to 15-year-olds. We hope to hear something this week. And then how that's going to be implemented, because there is adequate supply. And the governor has talked about using school systems, school clinics to help facilitate that, much like they did for teachers at this time. So, you know, with the younger students, there will probably be a lot of misinformation out there. So I think we're going to have to work doubly hard as we move in, as well as when we move into the summer, when this becomes a private-based method, and we're literally working individual to individual as we move forward. We'll try to work with the division to glean information that can help you target where some lower incidences of or greater instances of vaccine hesitancy is occurring, so everyone can help contribute with those efforts. So if there aren't any questions, I want to thank you again. Another kind of a little bit of a briefer meeting, but thank you for your time. Next week, we hope to have some special guests to kind of talk more about that transition and how your practices and facilities can be a part of that. So again, thanks for joining us this week, and we'll look forward to talking to you next week. Take care, and may the force be with you.